Do you find you have trouble hearing in noise? So as soon as you have no trouble having a conversation?
I can do, and that's why I think it makes it easier for me to actually focus on the person that I'm talking with and what they're physically saying. I want to be able to see that.
Yeah. The good news is that there's actually things we can do that to train your ability to hear better in noise.
So my first point of call isn't going to be, oh dear, panic, I'm going to need some kind of implant to be able to hear better.
No, you're actually, first thing is probably to learn how to hear a noise better through some sort of auditory training program that aims to do that.
Okay. I actually thought that anything that you're going to be doing is working towards old people getting hearing aids.
No, that's what I'm trying not to do. I'm trying to get the message is that there's different things we can do to hear well out there in the world.
Yeah.
And
I am so not old yet. Well, I'm just saying it, just throwing it out there. Yeah, but I worry about
it's actually
like that. But it is. I do worry about that. I've just recently had other diagnoses which are age-related, and it's just like, I'm falling apart. I'm not, but I feel like I'm
That's
falling.
why the things that cause hearing loss are, obviously we always think of age, we definitely think of noise.
Okay, well just quickly then, what are the main problems, or the main things that cause hearing loss?
Probably cardiovascular, diabetes,
Okay.
which are all preventable.
When would be the right time for someone to come and see you before there's an obvious problem?
So my recommendation is people actually come and see me just to find out how good their hearing is, because it's always a baseline and it varies from person to person when they should come.
Yeah.
But it's always hearing loss occurs before these other issues show up. So usually hearing loss is like the old canary in a cage in a coal mine.
Yeah, when it dies.
When it dies.
Okay, you know the last time, you'll hate this, the last time I had a hearing test I was still in primary school.
Well, that's not unusual. Because we think we're at that age, and during our teenage years, 20s, 30s, we think we're going to be perfect forever, be young forever. And it's always a shock as we get older that we actually have to do work hard to actually maintain the level that we want. But it's possible. There is no need for anyone to suffer from tinnitus. I keep on being told of stories where people are suffering, and I look at them and go, there's no need to it. No need to.
Okay.
It's possible. We can't always cure it, but we can have it so that people don't notice it most of the time. So some people react to sounds and perceive them as too loud or hurt them that other people think are completely normal. So again, that's one of my areas of specialty, is taking those people and allowing them to live a good life.
Okay, so four things. Physical and fitness.
Yep.
2 was
Noise,
as in stay away from it.
Yeah,
the really bad stuff.
Reduce yourself. Don't expose yourself to extremely loud noise for any length of time.
On a regular basis, yes. 4
is
certain drugs.
Certain drugs make you more susceptible to hearing loss, and stress makes you more susceptible to hearing loss.
Okay, and you can obviously advise, help look at someone's life in all of those different areas.
I certainly can. That's what I do.
And there's steps that take place before we start screwing in the implants and going for the bionic ear.
That's exactly right.